Caya diaphragm. A diaphragm is a flexible cup used with contraceptive gel that a woman puts inside her vagina before sex to prevent pregnancy. This video will discuss the Caya diaphragm and show you the steps to teach a woman how to use it. The Caya diaphragm is easy to use and comfortable to wear. Neither the woman or her partner should be able to feel it. It has no hormones and no side effects. The diaphragm comes in one size that fits most women, so she doesn't need a pelvic exam to fit it. The diaphragm works by covering the cervix and keeping sperm out of the uterus. To be most effective, she needs to use it correctly every time she has sex, no matter what. She can use it with any kind of water-based contraceptive gel. It's good at preventing pregnancy, but it's not the most effective method. If it is very important for the woman to avoid pregnancy, she can choose a more effective method where there is nothing she has to do or remember, such as the implant, the IUD, or the injection. Show the Caya diaphragm to the woman. Contraceptive gel goes in the cup that fits up against her cervix and adds extra protection. There are little bumps on each side to help grip the diaphragm. It's squeezed together for insertion, with the rounded front rim entering first. The little indentation fits a fingertip and makes removal easy. A woman can learn how to use the Caya diaphragm herself. It's simple, though she does need to be comfortable with putting her fingers inside herself to insert the diaphragm, check that it covers her cervix, and remove it. Here's how. She first washes her hands, then holds the diaphragm up to the light to check for any damage such as holes. She should do this each time she uses the diaphragm. Next, she adds contraceptive gel. She holds the diaphragm at the two bumpy places and pinches it together. Then places a line of contraceptive gel in each fold and a little on the front rim to help it slide in easily. She chooses a comfortable position, such as lying down, standing with one leg up, or squatting. Teach her where her cervix is and her pubic bone. Next, she separates the opening of her vagina. Pinching the diaphragm together, she inserts it with the front rim first, in the direction of her tailbone. She pushes it all the way in, as far as her finger can reach. Then, she pushes the front edge up to tuck it behind her pubic bone. Next, have her feel for her cervix with her finger to be sure it's completely covered by the diaphragm. The cervix will feel firm, like her nose. To remove the diaphragm, she inserts one finger into her vagina, hooks it into the little indentation, and pulls it out. If she doesn't aim the diaphragm toward her tailbone, it may not be positioned in the right place. If her cervix is not covered, she should take the diaphragm out and try again, aiming the diaphragm towards her tailbone. Her finger may not be able to reach her whole cervix, but she should have a good sense that the diaphragm covers it completely. Have the woman handle the diaphragm and review the steps for inserting and removing it so she understands how to use it. The diaphragm can be inserted at any time before sex, but before the penis enters the vagina. If more than a few hours passes before she has sex, she needs to put more contraceptive gel inside her vagina according to the directions of her gel. Screw an applicator onto the tube of gel, fill it up, and insert it into the vagina. After sex, she needs to leave the diaphragm in place for at least 6 hours. If she has sex again soon, caution her not to take the diaphragm out. Instead, she needs to insert more contraceptive gel before having sex. Caution the woman not to keep the diaphragm inside her vagina longer than 24 hours, or she can risk getting an infection. After use, the diaphragm is cleaned with soap and water and rinsed. It can air dry in its open case, and then she can store it. It's reusable for up to 2 years. The Caya diaphragm fits most women. If she is able to insert the diaphragm, the front rim is securely behind her pubic bone, and it completely covers her cervix, the diaphragm fits. If the diaphragm is too large, she may not be able to insert it completely, and it will be uncomfortable. If it's too small, it won't fully cover her cervix. If the diaphragm doesn't fit well, she should not use it for contraception. Women who have just had a baby will need to wait 6 weeks before starting to use the diaphragm. Remind the woman if she forgets to use the diaphragm and has sex without it, she can use emergency contraception. Advise her that she can use condoms together with the diaphragm to protect herself from sexually transmitted infections, including HIV. Only condoms do that. Remember, the diaphragm is inserted in the direction of the tailbone. Push it all the way in and tuck it behind the pubic bone. Check to be sure the diaphragm covers the cervix.